Good afternoon, everyone, and welcome to Snapshots Live, San Francisco Public Works' monthly webinar series. My name is Ben Peterson. I'm on the Public Works Communications team, and I'll be hosting today. We have a great show set up for you today with Joe Chin and Ignatius Tsang from San Francisco Public Works, as well as Kathy Jung from the Department of Public Health. They'll be talking to us today about their recent projects, renovating and rebuilding the city's community health centers. The presentation should take about 30 minutes with 15 minutes after that for Q&A. So if you have any questions, feel free to submit them either via the chat or the Q&A button at the bottom of your screen. So without further ado, let's get the show started with our first presenter, Joe Chin. Take it away, Joe.
Great, thank you, Ben. Can you hear me?
Yep, we can hear you, Joe.
Okay, great. So I just wanted to do a sound check. So good afternoon, everyone, and thank you for attending today's webinar. My name is Joe Chin. I'm the Public Works Program Manager for the 2016 Public Health and Safety Bond Program. And thank you again for this opportunity to share some of the great projects Public Works have been involved with on the Public Health and Safety Bond Program, or PHS for short. Let me first start by providing some general information related to the 2016 Public Health and Safety Bond Program. The PHS Bond Program was approved by voters in November of 2016 for an amount of $350 million to fund capital projects related to public health and safety. This bond program follows the 2008 SFGH rebuild program that provided funding to build a new acute care hospital on the Zuckerberg San Francisco General Campus. The PHS program provides funding for 6 main components for 3 client departments: Department of Public Health, San Francisco Fire Department, and the Department of Homelessness and Supportive Housing. The 6 bond components are ZSFG Building 5. For those that are familiar with the ZSFG campus, Building 5 was the former acute care hospital until the new replacement hospital was completed in 2016. Southeast Health Center, community health centers, ambulance deployment facility, the neighborhood fire station, and homeless service sites. The ZSFG Building 5 component carries a budget of $222 million, which is the lion's share of the PHS funding. This component is tracking 19 core projects, with many of the projects focused on DPH's vision to convert this 1970s building into an updated ambulatory care center by consolidating clinical services under one roof and to update the building's infrastructure. One of the main projects that's currently underway is the seismic upgrade of Building 5. Other projects include the relocation of Public Health Laboratory from 11 Grove Street and relocating dialysis clinic from Building 100 to Building 5. Other upcoming projects include relocating Family Health Center from Building 80 to Building 5. The homeless service site component carries a budget of $20 million and is tracking 5 main projects. 440 Turk Street was one of the first projects out the door, and it was completed in 2019, which created the new administrative office and client access point for HSH. 1064-68 Mission is currently in construction and is a joint project with DPH that includes building out new office space for the San Francisco Homeless Outreach Team, SF-HOT, and relocation of the Tom Waddell Health Clinic. Many of the HSH projects are partially funded by the bond program and includes funding from other fund sources. The ambulance deployment facility project carries a budget of $48.6 million and consists of constructing a new state-of-the-art essential facility that will be used for the parking of the ambulance fleet and restocking of the ambulances, as well as providing spaces for training, conference rooms, and other administrative functions for the San Francisco Fire Department EMS group. I also want to give a quick shout out to the ADF team for completing the project on May 4th, followed by a successful ribbon cutting ceremony this past June. The neighborhood fire station component carries a budget of $9.4 million and consists of 2 categories of scopes. Scope 1 is the removal of the existing host towers to improve the seismic safety of the fire stations. This will occur at fire stations 6, 11, 12, 15, 21, and 38. Scope number 2 is the replacement of the existing emergency generators. This scope is currently planned for fire stations 18, 37, and 44. Last but not least, the neighborhood health clinic component carries a budget of $50 million and provides funding for 3 main health centers: Southeast Health Center, Maxine Hall Health Center, and Castro Mission Health Center. Southeast Health Center includes the construction of a new health center adjacent to the existing clinic. Maxine Hall and Castro Mission project scopes include seismic upgrade as well as major interior renovation. At this point, let me turn over the presentation to Kathy Jung who will be discussing how the community health center clinics fit into the overall San Francisco Health Network healthcare system and DPH's vision for these community health centers. For many of you, you may automatically connect DPH to the Zuckerberg San Francisco General Hospital just because ZSFGH tends to get a lot more recognition than community health centers, as is the only trauma center hospital in San Francisco. However, I hope after today's webinar, you also learn about a smaller but equally as important healthcare service provider within DPH. Kathy, take it away.
Thanks, Joe. Good afternoon, everyone. Thank you for joining us this afternoon. I'm Kathy Jung, the Director of Facilities and Capital Planning for the Department of Public Health. Since 2016, I've been working with our DPW partners to develop and deliver these 3 primary care clinic projects. The 3 clinics are part of the San Francisco Health Network, which comprise the direct health services provided by the department. The network includes 10 community-based primary care clinics and 2 hospitals, Laguna Honda Hospital and Rehabilitation Center and Zuckerberg San Francisco General Hospital, which is the only, as Joe said, only trauma center serving all of the city and northern San Mateo County. Annually, we serve more than 100,000 people in our clinics and hospitals. We provide continuous care for people wherever they are, in the clinics, hospitals, at home, in jail, or transitional housing. As the city's public health system, we also provide mental health and substance abuse care to any San Franciscan who needs it. This short video will give you some insight as to the scope and breadth of the services that the network offers across San Francisco. Our 10 community-based primary care clinics are geographically dispersed throughout the city, including locations in the Tenderloin, Western Addition, Potrero Hill, the Mission, the Bayview, Chinatown, and the Sunset. San Francisco Department of Public Health's true north, mission, and vision are summarized in this visual triangle. Our mission is to protect and promote health and well-being for all in San Francisco. Our vision is to make San Francisco the healthiest place on earth. True North is a set of ideals which serve as a compass for getting to DPH's ideal state that we are continually striving towards. These ideals serve as the basis for strategic planning and guiding leadership in setting priorities and metrics across all levels of the organization. While departmental tactics and strategies may change, the ideals do not change. The 6 True North pillars are 1. Safety and security. The goal being to ensure safe environments for our clients, patients, and staff. 2, health impact, to improve the health of the people we serve. 3, service experience, to provide the best experience for the people we serve. Workforce, to create an environment that respects, values, and invests in all people. 5, financial stewardship, to ensure a transparent and accountable stewardship of resources. And 6, equity, to work towards eliminating health disparities in our communities. Next slide, please. In June 2016, DPH undertook a week-long 3P workshop with the goal of creating a conceptual future state where both process and facilities design supports an integrated and collaborative team-based care model that emphasizes human interaction, seamless flow, efficient configuration, and physical safety. For purposes of the workshop, 3P stood for product, process, and plant. Teams in 3P are designed for better problem solving by including people from different backgrounds and experiences within and outside of the department. It allows for prototyping and simulation to be done by the people that are closest to the work, our patients, providers, clinical administrative staff, clerks, and eligibility workers. Members of the design team were also included in the process. The conceptual future state that was created by the 3P workshop translated into a basis of design for all 3 of the primary care clinics supported by the 2016 bond. Next slide, please. Key themes that came out of the workshop and drove the base of design for all the clinics included: 1, establishing what we refer to as onstage and offstage areas that separate patient and staff spaces. In the diagram to the right, clinic spaces accessed by patients are shown in yellow, and staff exclusive areas are shown in orange. This separation includes separate staff and patient entrances, which enhance both privacy and safety. Another significant element was creating patient care pods, which is a combination of medical exam rooms and behavioral consultation rooms with a staff collaborative area in between. The collaborative area is comprised of non-dedicated workstations shared by all staff that are involved in caring for patients, including but not limited to physicians, nurses, behaviorists, pharmacists, and social workers. This close proximity of staff to one another allows for better communication and warm handoffs, which allows patients to stay in one place when receiving services from multiple providers. Providers enter the exam room and consultation rooms from the collaborative orange areas, while patients enter the patient rooms from the corridor shown in yellow. Another major goal was to design universal rooms that are flexible and adaptable as needs may change in the future. Next slide, please. The 3 clinics that are currently in construction are Southeast Health Center in the Bayview, Maxine Hall Health Center in Western Addition, and Castro Mission Health Center in the Castro. Next slide, please. We are looking forward to celebrating the reopening of Maxine Hall with a formal ribbon cutting ceremony next month. The plan is to reopen the clinic to patients in October. Located in the Western Addition for more than 50 years, the clinic serves about 3,600 patients annually. Services include regular checkups, prenatal care, women's health services, behavioral health services, short-term counseling, access to basic resources, and nutrition education. Next slide, please. The scope of renovations include seismically retrofitting the building, expanding clinical spaces, accessibility improvements, and upgrading the fire life safety systems. The total project cost is $19.5 million. Project benefits include improved clinic workflow that benefits patients and staff, 7 new exam rooms and larger exam rooms that will be able to accommodate patients and their family members, new group therapy spaces, and updated facilities for staff. Next slide, please. Ignatius?
All right, thank you, Kathy, and welcome. I am Ignatius Tsang. I am DPW's Bureau of Architecture's senior architect. responsible to bring about the transformation of the neighborhood health clinics. Our clinics are over 50 years old and had no major renovation. As per the name of the 2016 bond, we are updating our clinics to make them safe and healthy. But more importantly, we're going to implement DPH vision of a patient-centered and team-based care model as described by Kathy. The concept is very simple. It's like students stay in their homeroom and the teacher comes to them. So the patient goes to the exam room, doctors and nurses and other care providers will go to the patient. This will reduce the anxiety and the confusion for the patient because they don't have to schedule multiple visits, come to the clinic multiple times, and then they don't have to run around to find the next appointment. And the providers are able to care for their patients holistically when they are integrated and in the same space. Maxine Hall Health Center is the first of the 3 health clinics. It was designed by BOA. This building needs a complete building overhaul. In order to do that, we have to relocate the health program into trailers to maintain full and continuous operation for our patients. The photo on the right are the trailers that I was talking about. The building structure needs to be seismically strengthened. And so the photo on the left, we're going to create the new concrete shear wall in the building exterior. As you know, shear walls are pretty blank and not good looking. So we're able to cover up these shear walls with murals. The design of the murals are by Wing Eng, one of our famous local artists. Some of you may remember the store Taylor and Eng, a boutique store with very well-designed products. One of the important aspects of remodeling is to improve access, to remove barriers. So by creating a new elevator and correcting the slope of the ramps, some of the things we are doing. But before we can do any work, we must abate all hazmat material, not only to protect the contractors who are working on the project, and also for the return occupants of the clinic. The photo on the left shows the hazmat containment, and the photo on the right is the new elevator hoistway. To improve air quality, we are adding new HVAC for the clinical area. We were asked to switch to electrical equipment, but we were not able to do that because we are too well in the way of getting our building permit. To create a new team-based care model, we reconstructed the entire second floor. The photo on the left shows wall framing, and the photo on the right shows the team space. To reduce energy consumption, we replace all the exterior window with double pane glass and refresh the PV on the roof. So the photo on the left shows the new window replacement, and the photo on the right shows the PV on the roof. Kathy?
Thanks, Ignatius. Southeast Health Center has been located in the Bayview Hunters Point since 1979. Services include care for common illnesses, confidential HIV testing and counseling, pregnancy testing, prenatal care, mental health services, and vision care. The scope of work for this site is being completed in 2 phases. The first phase was an update of patient waiting areas in the old existing building, as well as a total renovation of the dental clinic. Phase 2 is the construction of a new 2-story, 22,000 square foot clinic. Total project cost is $42.5 million. The new clinic provides a state-of-the-art clinic configuration that supports workflow efficiencies, safety and security, and great patient experiences. It includes larger patient rooms to accommodate patients and their families, space for group therapy sessions, and large flexible multi-purpose rooms for use by the clinic and its community partners. Back to you, Ignatius. Next slide, please.
Thank you, Kathy. So Southeast Health Center addition was designed also by BOA. This is a new 2-story building from the ground up. The beauty of a new building is that we are not constrained by the shape, the size, and the infrastructure of the existing building. We can be faithful to DPH vision of the integrated and collaborative team-based care model. You can see in this slide, we have started the foundation work. And for your reference, the existing Southeast Health Center is to the left. The photo on the left shows the first column was to be set, and the photo on the right shows the rebar of the first floor slab. The photo on the left shows the team-based care model between the exam rooms. It is filled with natural daylight coming from the skylight above, from the art glass wall on one end, and from the clear glass wall from the other side. The photo on the right shows the decking of the roof. It's not only support all of the mechanical units, which is scheduled for next week. So things are moving fast. It also will support an array of PVs. Trenching for the underground utilities in the rear parking lot will complete soon, and we will be installing EV charging stations. And together with the PV on the roof, we will reduce energy consumption and make our environment better in spite of the global warming. The project is on schedule. The photo on the left shows the steel structure is up, and the photo on the right shows the building exterior is being insulated. The exterior curtain wall will be next. Kathy, back to you.
Thank you, Ignatius. So the third and final clinic is Castro Mission Health Center that is located on 17th Street in the Castro. The clinic serves about 4,200 patients annually. Services include HIV treatment and prevention, behavioral health services, pharmacy, podiatry, nutrition, and access to resources for food, shelter, clothing, and transportation. The scope of renovations included seismically retrofitting the building, expanding clinical spaces, accessibility improvements, and upgrading fire life safety systems. The total project budget is $14.5 million. Similar to the other benefits that we are achieving on the other clinics, it improves clinic workflow. We will get 12 new exam rooms that provide more room to accommodate our patients and their families. Again, new group therapy spaces and updated facilities for staff. These photos show the reception waiting room updates, as well as the new facade on the building. Next slide, please. Back to you, Ignatius.
Castro Mission Health Center was designed by MEI architects. When BOA doesn't have enough capacity, we often team up with our outside consultants. We partner with a number of architects in San Francisco, and this is one of them. This is a complete exterior and interior renovation. The building was vacated, and the clinic was temporarily moved to the CSFG campus. The photo on the left shows the exterior wall is getting ready to receive shotcrete to make it part of the as part of the seismic strengthening. The photo on the right is the transformation of the concrete block wall into the seismic shear wall. The photo on the right shows hazmat containment, and the photo in the middle shows the sealing work. The photo on the left shows the building interior prior to becoming the team-based care model space. The photo on the left shows new electrical work and data. The photo on the right shows new mechanical ductwork. There are many lessons learned from these three projects, such as conduct an in-depth investigation of the existing building conditions and its infrastructure. That includes verifying the capacity of the existing utilities. Before we decide to keep the existing ductwork, we should pressure test them. We should also analyze the constructability of the design prior to put it on paper. We also need to anticipate and plan for delays and scope creeps, because they always happen because we don't know every situation. And most importantly, we need to make sure that we have temporary facilities for the continuous care of our patient. Joe will take this presentation home by talking about the up and coming neighborhood health clinics. Joe?
Okay, thank you, Ignatius. Let me wrap up today's conversations by spending a few minutes to talk about the future of community health centers. As part of the city's 10-year capital plan, DPH is working closely with city leadership on a proposed 2023 bond program. Projects that are currently proposed for this bond program include the Chinatown Public Health Center and Silver Avenue Family Health Center. I am particularly biased toward the Chinatown Public Health Center just because I still remember my parents taking me to this clinic to get my shots growing up in San Francisco. Renovation to this clinic is well overdue. As Ignatius had discussed earlier, Public Works involvement on these three recent health centers are allowing us to collect lessons learned and best practices that will be implemented for the projects in the future bond program. Some of these concepts include performing an early seismic evaluation of the building structure in advance of starting design by seeking either pre-bond funding or performing the analysis as part of another bond program. For example, we have already completed the seismic assessment for Chinatown Public Health Center, Silver Avenue, as well as a few other community health centers as part of the 2016 PHS program. This approach will allow the design team to hit the ground running during the early conceptual design phase in terms of establishing the basis of design and final outcome. The team is also adding electrification and air conditioning scopes to the building as part of the basis design for all future health centers. The objective to electrify all public buildings is driven by the city's desire to transition to cleaner and more sustainable energy sources, such as solar power, and to exclude all natural gas sources. The city's determination to achieve this objective was codified in the passing of an ordinance in 2020 to require all new construction and major renovation to exclude natural gas as an energy source on all public buildings. The project team was approached by city leadership to consider adding electrification to the Maxine Hall, Castro Mission, and Southeast Health Center projects in 2019, when this ordinance was still being developed. But our projects were already in construction, permitting, and late phases of design, and to add this scope so late in the process will cause significant delays on schedule and budget impacts. The ongoing global climate change is also driving the need to include air conditioning in the health centers in order to ensure that the health centers can be functional even during severe hot weather days, which we have been experiencing more frequently in the past few years. Another important lesson learned is that all project scope and budget must consider enabling projects as part of the base scope. And what do I mean by enabling projects? For example, one important aspect unique to health center is that even during major renovations, DPH must consider alternative options to providing a means to maintain clinical services to the community during construction. One option, which is probably not the best option, is to phase the project and to have the clinical operations stay in the building during construction. We have learned that this option comes with a lot of challenges and potential delays due to noise, vibration, power disruptions, logistics planning, etc., that will negatively impact the delivery of care to patients, as well as the impact to the contractor's sequence of work. For example, in Maxine Hall, the project team went through a lot of heroics and overcame a lot of challenges to procure and utilize mobile trailers to create a temporary clinic at the Ella Hill Hutch Community Center Parklet. Challenges include finding a suitable site for the temporary clinic that is close to the existing clinic that it serves, permitting for the new clinic, and construction and implementation of the temporary clinic itself. For Castro Mission, we were much more fortunate as we were able to move the Castro Mission Clinic to the vacated old urgent care space on the ZSFG campus with some modest renovation. With support from city leadership and San Francisco residents on the proposed 2023 bond program, all these ideas will be put to use on the Chinatown Public Health Center project and all other clinics as well. At this point, that concludes our presentation today, and let me turn it back to Ben for Q&A portion. Thank you.
Thank you, Joe. And thanks to the rest of our presenters as well for giving us the rundown on these really crucial projects. We're going to start with our Q&A portion of the webinar right now. So if you have a question and you have not gotten the chance to ask it yet, you can submit it just through the chat or the Q&A button at the bottom of your screen there. Our first question, I guess it's kind of like an open-ended one that anyone could kind of could answer. We're just wondering, like, what were some of the setbacks, if any, that have been due to the COVID-19 pandemic, whether it be in the design process of new clinics, or the construction process, or the operation of existing health centers?
Why don't I jump in? I can speak a little bit more on the construction side and how COVID-19 during this past 18 months has been impacting our projects. I think in general, when the first ordinance was approved or issued by the mayor, there was some confusion in terms of what projects were allowed to continue. But I think with the CM team, the city, and all the other resources, we're able to quickly sort through that, and work continued because all public works projects were deemed to be essential. So there was really minimal impact on the work itself. Obviously, with some of the ordinances, there has been discussions from a lot of new requirements that were implemented due to the health ordinance. For example, the need to routinely, regularly clean the public spaces used by contractors, making sure there's health checks for all the workers, more documentation. So we are seeing some costs that contractors have submitted for COVID-related impacts.
May I jump into?
Yeah, sure thing.
The COVID-19 really had put a stop on the supply chain. So a lot of equipment that we thought will be coming were delayed quite a bit. And so it really impacts on the schedule to get our project done. And it also increased some cost because we have to substitute products that are not available anymore to products that are more available. They're not off the shelf. So there are challenges in that way too.
I think from the end user perspective or stakeholders, it's just the disappointment that there are delays in completing construction and getting back into their home clinics. But they understand that, and it's been fortunate that, in some respects, some of the utilization has been down at their makeshift sites, which has helped for them to be able to deliver services, continuing the delivery services during this time.
All right, thank you, three. As was the case with basically everything else, it seems like COVID has had a pretty significant impact. But this next question, I guess, might be best suited for Kathy or maybe Joe. When designing a new health clinic or rebuilding one, how do you factor in the specific needs of the demographics of the neighborhoods that the health clinics will be in? Do you look at age demographics or anything like that for any sort of like design inspiration or figuring out which kind of programming to include at a health center?
Well, why don't I start? So,
Sure.
each of the clinics, we have tried to obviously model a certain type of style in terms of the collaborative style and the way we want to be able to do this on-stage, off-stage design. And as,
Mhm.
Ignatius alluded to, it was much easier to do that on a greenfield type project like Southeast Health Center, whereas we've had to bend ourselves and contort ourselves a little bit at Castro and Maxine, to come up with that. But generally speaking, each clinic does also have a bit of its own personality, right?
Mhm.
And so that's reflected in any kind of specific adjustments or accommodations that we're able to make, for the types of services that have historically been delivered at the clinics. But the clinics have a lot of similarities, so there wasn't a lot of that. I
Mhm.
think at Southeast Health Center, we had the opportunity to really try to embrace their relationship with the community by being able to create a multi-purpose room, very large space that will be shared with the community partners, that will allow the clinic to do large health education classes, but as well as allowing community organizations to come in and use that space in partnership with the clinic.
Great. Thank you, Kathy. Did anyone else have anything to add in there, or we got a couple more questions if we want to move on?
Well, I think like the Maxine Hall, we employ local famous artist Win Eng, and use his design to express it in the exterior of our building, to really honor our local residents. Each clinic takes on the neighborhood that they serve. So we do have a more consistent way of caring for our patient in terms of the team-based design, but that is is not take us from considering the patients who we serve in all these different neighborhoods.
Great. Thank you. That actually kind of transitions perfectly to the next question. It was actually about the murals at Maxine Hall, and I'm wondering if there are other types of like public art, whether it be murals or statues or sculptures or anything at the other health centers that we're renovating or planning on building.
Yeah, maybe I could jump into that. For the Southeast Health Center edition, we have several artists providing artwork in our building. In the lobby of the new Southeast Health Center edition, we have a beautiful tapestry that a local artist is weaving, and it will be displayed. And my understanding of the weaving concept is to really bring all the people together. And so we knit it together as patients and providers into one. And so it's a beautiful symbolism, and it will be very iconic. We have another artist who's going to create these glass wall that I had mentioned in the team room on the second floor. They take on the nature aspect of it. They would provide light into this team space, but they also identify the different parts. So when patient needs to go to one area, they would say, go to this. Let's just say the birds. So it's a wayfinding, it's a landmark a way of making it more easy and simple for patients to navigate in our buildings.
Great. Thank you, Ignatius. We have a few more questions and a couple more minutes here. This next one might be best for Joe, I think. Kathy, in her portion of the presentation, discussed the 3P process of planning and designing health clinics. But I was wondering if we employ any similar kind of strategies or like those types of frameworks to when we design other types of buildings, whether it's like a firehouse or a full hospital or a school. Are there Are there other instances where we use that same kind of strategy and planning technique?
Great question. I think 3P, you know, the concept of 3P comes from lean construction, which has been around for a long time. It dates back to the Toyota manufacturing process to eliminate waste. So, you know, maybe, you know, some of the other projects may not undergo a rigorous 3P process as DPH, but I think a lot of projects are adopting that approach in terms of, you know, really the end product needs to be focused on the stakeholders or customers. In this case, is making sure instead of designing a space for the stakeholders or end users, you kind of flip it around and say, you know, end users, we want to make sure we understand what your workflow is, and now let's design the space to fit what your needs are. So it can apply to, I think, any building, anything you do, just like if you were to undergo just even a simple, you know, house renovation for your own, for yourself, you know, taking that same process makes a lot of sense, because you really want to, especially you have a clean slate that you can start with, that you can really mold a design to what most efficient for your type of work and what you need to deliver, you know, for yourself or for the client.
I think for us, for the clinic projects, we really had the opportunity to use the process correctly. You really should do 3P work prior to initiating design. So the department, particularly at Zuckerberg, when we were doing the rebuild of the hospital, we were already in our lean journey. So the department has really very much embraced the concept of lean work. So it's not really the construction piece that we did, but it's just process, how we do work, you know, how does our work flow. So we did a number of 3P efforts in the reverse. It should have been done before design, but we basically employed 3Ps to figure out how we should restructure operations to fit the new hospital building. So it was kind of done backwards at Zuckerberg, but with the clinics, we really understood, well, that should have been done first. So that was the very first piece. And 3P is also a very extensive, time-consuming, resource-driven kind of thing. When you saw the picture of the 20 plus people that were involved, everybody in that picture was there every day for a week. So you really need to make the commitment to the process. People are very like, oh, this is awful, we don't want to really be here, but the second day they really get it. We do a lot of really kind of weird ways of approaching, you know, string diagrams, kind of understanding how flow works or doesn't work. And it's a really good process to really understand. And I think the product that is coming out of this is really good. We also had done a lot of research of what other clinics were doing across the country. And it was all also based upon work that they had done with 3P. So the Veterans Administration had adopted a whole book or process for all their future clinics. So that really helped us a lot. But we also had to go through our own journey to see whether that worked for us. So, but I highly recommend it, and we would not do it again. So a project, we would not want to do another project without first employing the 3P effort if it's something new. So going into Chinatowns, many of the people, well, not many, but several of the people who were involved in that 3P process in 2016 were actually from Chinatown. So we tried to embrace not only the clinics that we were remodeling, but future, so that future state could be embraced by all the clinics across our network. So it's really going to help us. We don't have to do a lot of redesign. We're not trying to recreate the wheel now, right? So, and hopefully it'll be a smoother, more efficient, and faster process of design.
So for BOA, you know, we do a lot of projects. So for instance, in this 2016 health and safety bond, we have a number of fire stations that we have to work on. We have a number of navigation centers to work on at the same time. So we did not do a formal 3Ps as DPH had done, but as the bureau, our architects, we spent a lot of time working with our clients, with all the different fire station chief to truly understand how they operate, how they function, and find some commonality. You know, if it is efficient for one fire station, it should be able to apply to others. So we did our discussion with them. And the 3P process is really a great one. We don't only do it for building types. We in fact have mock-ups. And Kathy knows that we are mocking up exam rooms to make sure that the exam room, the placement of all of the equipment, the exam tables, the lights, the computer, the pumps, and pressure cups, and all of those work out so that we know we could create a template that we had brought in doctors and nurses to come in and test it out. So this is a great process that BOA we totally embrace, and it is a benefit to all of our projects.
Right, I think that's part of the simulation process that I spoke to briefly as part of the 3P. But it's also, I want to make clear that our process that we used for the clinics was a facilitated, guided process by consultants that had been working with the department for some time with our lean journey, if you will. So I don't know that you can completely do it on your own. They are very savvy consultants that had, tools that they employed to guide us through, and I don't think we would have been able to do it on our own.
Great. Well, really appreciate your guys' willingness to field all of those questions and running through the process, the very detailed process of building and designing these neighborhood health clinics. It seems like the results that they yield are going to be really great for a bunch of different communities throughout San Francisco. I'd like to thank all three of you again, Joe, Ignatius, and Kathy, for taking the time to present for us today and all the preparation that it went into. You guys did an amazing job. I want to thank all of our attendees as well for joining us today. And we'll be holding the next installment of Snapshots Live next month on September 16th. Be on the lookout for an update on the topic as well as the presenters for next month. That should be coming out very shortly. And I'd like to thank you all again and have a nice afternoon.